Hello, friends. Welcome to my YouTube channel Pathology Academy. I'm Dr. Aditi Kumar, and today I'll be discussing about approach to pancytopenia. So let's get started. What is the definition of pancytopenia? Well, in pancytopenia, there is a reduction in all three blood cell lines. That is, RBC, WBC, and platelets all are reduced. So there is anemia, leukopenia, and thrombocytopenia. Now let's discuss about the causes of pancytopenia. It could be because of decreased production, it could be because of marrow infiltration, peripheral destruction or sequestration, or infections, and some are miscellaneous causes. So under decreased production or marrow failure causes could be aplastic anemia, megaloblastic anemia, myelodysplastic syndromes, inherited marrow failure syndromes like Fanconi syndrome or Diamond-Blackfan syndrome. Marrow infiltration causes include acute leukemias, lymphomas, multiple myelomas, metastatic tumors, myelofibrosis. Peripheral destruction of blood cells or sequestration of blood cells, the causes could be hyperspinism and autoimmune diseases like SLE, Evans syndrome. In infections, it could be because of leishmaniasis, tuberculosis, viral infections like HIV, hepatitis, EBV, parvovirus B19, and miscellaneous causes of pancytopenia includes drugs like chloramphenicol, chemotherapeutic drugs, antimetabolites, and toxins like benzene and radiations. Pancytopenia is a common cause for bone marrow aspirate or bone marrow biopsy. As I have enumerated, the causes may vary from nutritional to bone marrow failure to infiltrative malignancies, and patient can present with symptoms like fatigue, frequent infection, bleeding or bruising, and organomegaly. Before ascertaining the cause of pancytopenia, we should first take proper history and do proper examination. In history, drug history is very important. Inquire about chemotherapeutic drugs usage, antibiotics or anticonvulsants usage, any exposure to radiation or toxin, any infections like HIV, hepatitis, TB, Kala-Azar, etc., and family history of any inherited marrow failure syndromes. Also, on examination, do look for splenomegaly or hepatomegaly. Next step is the basic lab tests which are asked for, which include complete blood counts with peripheral smear, reticulocyte count, LDH, bilirubin for determination of hemolysis, viral serology like for HIV, hepatitis, ABV, parvovirus B19 infection, and autoimmune screen if it is suspected. Peripheral smear can give clues regarding the diagnosis of pancytopenia. For example, if macrocytosis plus hypersegmented neutrophils are seen in the peripheral smear, we can think about megaloblastic anemia and ask for B12 and folate levels. If teardrops and nucleated RBCs are seen, we can think about myelofibrosis. If we see blast, we can think in terms of acute leukemia. If hemoparasites like LD bodies, macrofilaria, or malaria are diagnosed on a peripheral smear, that cause we can ascertain. A leukoerythroblastic picture, that is presence of nucleated RBCs with shift to left if it's seen, it gives a clue for marrow infiltration by lymphoma or metastasis. While doing bone marrow examination, we should look for cellularity. If it's a hypocellular smear, it can denote aplastic anemia. If the smear is hypercellular, we should look for leukemic cells or any lymphomas. Lineage maturation is seen for dysplasia, aplasia, infiltration. Also, special stains or IHC like iron stain, reticulin stain, IHCs for blasts, CD markers, etc. should be done to ascertain the cause of pancytopenia. Here I have given the algorithmic approach. First of all, confirm pancytopenia by complete blood counts where you will see reduction in RBC, WBC and platelet series. Always complement it with the reticulocyte count, which is generally reduced in cases of pancytopenia. Review peripheral smear, rule out nutritional causes, do a vitamin B12 or folate assay, screen for infections, proceed to bone marrow aspirate and biopsy, and apply IHC cytogenetics flow cytometry as needed. Some examples: most common cause of pancytopenia in India is megaloblastic anemia. Most important diagnosis to exclude is aplastic anemia, as it's a life-threatening condition. Bone marrow biopsy is mandatory if aspirators dilute or there is dry tap, and always correlate with clinical context. So I hope I have given you an overall idea how to approach a case of pancytopenia. I have enumerated the causes. I have given you an algorithmic approach. I hope this session was useful for you all. Thank you and bye for now.